Hi, and welcome back to Questions from Quarantine with the Security and Global Health Project. I'm Tara Tyrell, and we're here with Dr. Margaret Bourdeaux, our research director, and Professor Juliette Kayyem, who is a senior lecturer in public policy at the Belfer Center at the Harvard Kennedy School. We're going to jump right into our questions this week because we have one question that we've noticed is particularly on everyone's mind, and that question is about masks. So first, I'd like to talk to Juliette and get her opinion on why the CDC changed their guidelines on wearing masks. What does this mean in terms of preparedness now moving forward? And what would you have done, Juliette? Would you have done what the CDC did? Do you think you would have handled it differently? What's your perspective on that?
So look, listen, like look, I'm not the doctor, but so from a policy side, there's different kinds of masks. So let's be clear here. The masks that we're all debating and that states are fighting over are not the masks that you and I are talking about. And anyone you see walking around with one of those high-end hospital masks, you need to smack them. Like, people should not be wearing that stuff. That stuff needs to go to the medical and health community, or maybe people with previous conditions. So I was definitely, just as a psychological issue, sort of opposed to masks. It seemed like a bridge too far, even though I've been pretty far on this stuff for a couple of months now about how much aggressive social distancing we have to do and stuff like that. It just seemed, I don't know, it was irrational. The CDC had been very, very insistent against masks before, but they were, if you look at their language, they were kind of conflating all masks. I think what they're doing now is they're basically saying we should be inside, and when you go outside, to both protect yourself and to protect others, wear a mask. I will tell you now, in literally just 72 hours, here's mine. It happened to be on my desk, but here's my mask, made by a friend. I believe it's like a social gesture now. Like, I believe like going to a market without a mask, like it's just like you're making a statement that you care. And I did go running. I'm a long distance runner. I ran 8 miles yesterday, and I wore a mask. Like, I retrofitted some weird thing, and then I get back, and then Dr. Fauci, who's recommending mask, says he does not wear one running. So now I feel liberated that because it was hard, I couldn't breathe. But anyway, so that's sort of where we are. And I do think there's like a community effort behind all of this, like social distancing, that this falls into. But now Margaret's like the smart person about masks. So I'm just telling you my weird psychological relationship with them.
I mean, I think you're absolutely right, Juliette, in terms of what, how the CDC has come at this. I would say I've heard masks be called the last line of defense. And I think that's a really nice way for folks to think about it. You know, at the beginning, I think there was really a push to just emphasize hand washing, emphasize, which does work. That is the most effective thing you can do. Emphasizing the social distancing, which obviously is a really huge thing to emphasize. And now the masks as, playing a role in adding that extra layer of, defense. Masks are not perfect. They do not substitute for all of those other things we just mentioned. There is, of course, data to support that they do protect in a couple of ways. One, they do, they're not perfect again, right? But they do offer some measure of protection against you transmitting viral particles, and also from you being exposed to viral particles and droplets in the air, potentially. Again, not perfect, but a small, measure. And I think it also does help people not touch their face so much, which is always very hard. And I think it signals to everybody else that this is serious. We're in it. We're going to do this, and we're going to do everything we can to help each other, which I think is the most important thing we need to communicate. So, yeah.
Great. And along the same lines of sort of calming fears, debunking myths, we've gotten a lot of questions about reinfection. I know not a lot is known about COVID in terms of can you get it again? If you do get it again, are you getting similar symptoms? I know there have been some reports coming out of China that perhaps some people were released too early, and what looks like reinfection was actually them still being sick the first time. So, Margaret, I'll start with you just from a medical perspective. What should we be concerned about as best as you can tell now for what the science is telling you as far as reinfection is concerned? And then Juliette, after she's done answering that medically, what does that mean for preparedness? What does that mean for a second wave? Are we going to be sheltering in place again, on down the line?
Yeah. So medically speaking, what we can say is that the case that there doesn't seem to be much evidence for reinfection. And when we look at how the virus has mutated so far, all viruses mutate a little bit as they replicate and propagate. So what we can see is this is just a normal amount of variation that the virus has developed. There's no reason to think that it's transforming, mutating into something that your immune system wouldn't recognize once you had been infected or if you got a vaccine. So there's nothing here that looks scary. And I'll just make one other point. I think there is this sort of mythology around this virus right now that seems to be growing. It's like, oh, this is such a special, unique virus, and it is so, it has all these special properties, means it's not going to respond to basic public health measures. It's not going to respond somehow to, all the things that we know protect us in general. And we just need to avoid that. This is a virus that can be contained. It can be addressed. It can be managed through things that we know how to do.
That's so optimistic. So I just wrote a piece with the colleague at the School of Public Health for USA Today that talks about this notion of consilience, which is from E.O. Wilson, and it's this idea that when multiple disciplines converge on a common plan. So here's Margaret on the medical side, public health, homeland security, economics, all the real experts, I like to say, have converged on what the plan is, which is exactly what Margaret said, which is we are in the hard phase. It's going to lead to sort of how do you manage around this virus until we get a vaccine. Each of them are hard, and all of them will be different than before this year. So like the management phase will feel weird because things will open and other things will close. God knows when, there'll be another Super Bowl or like you'll go to a concert. I don't know. I mean, people are always asking for dates. It's all metrics. It's not dates anymore. There'll be better treatments, which people seem pretty hopeful about in the literature. But definitely you sort of, there's going to be different tools, right? From a public policy perspective, there's going to be different tools from testing to treatment to vaccine to even shaming, that there'll be aspects to this in which as communities, we say to people who are sick, you're not coming out, or families that need to be isolated. So there's going to be different pieces to this. So I'm optimistic in the sense of there's a plan. The plan is being poorly executed because we have no federal leadership. The poor execution is now being filled by what I call the fail-safe system, which is, in disaster management, it's a system that comes in to stop the cascading losses after the damage is already done. Little did we think that the damage would come from the federal government. And that's sort of what we're waiting for. We're just buying time at this stage. So whether it mutates or comes back or can get it again, I just feel like we're going to be having a different conversation in July in terms of what the tools are.
Thank you. And this is a good segue into our wrap up, which is our sanity and sanitation segment. So as we are getting ready to hunker down for an indefinite amount of time, as we get used to our new normal, each of you hopefully has a tip for us on how best to stay sanitary, how best to stay sane. Margaret, could we start with you?
Absolutely, as I'm trying to usher my children out of my workspace.
I saw that. I saw those eyes going. That was hilarious. It was like the maternal evil eyes.
Exactly. It was the mother evil eyes. Yes, my tip is, and again, to do this with your mask and to do this with social distancing in mind, but go outside.
Yes.
Try to get outside. Try to breathe some fresh air. It really is important every day. And then the second thing is make sure that you laugh one time a day. When you go to bed at night, I want you to think, what did I laugh about? And it can't be something mean. It has to be something that is, genuinely humorous or self-deprecating.
Yeah,
once
that
a
is
day.
so awesome. So the outside thing, I can't say enough, and my kids aren't going outside enough. I'm sort of realizing that, and so I need to get them out. But with masks, here's mine. Here's mine. And then mine might be more spiritual today. I'm not a very spiritual person, but I just was very moved. A friend of mine had been the head chaplain, minister, reverend at Harvard's Memorial Church, and then has gone to Wake Forest. And he has, Jonathan Walton, and he sent me his sermon that he had to give, outside with no audience. And he talks about we're going to drive ourselves crazy if we look for the new normal. And so instead we have to embrace the now normal. And it's like, literally, it was like, I'm not very religious, but it was like this grounding thing where you're like, yeah, like what today is actually normal. Because if I keep hoping for things to be some normal or new normal, even, that's not going to be that way honestly, people, for the rest of this year. And so you're going to just go crazy thinking, if only, I'm like Margaret, I'm a working mother. She has 4 kids. I have 3. And my husband, a couple years ago, I guess I had gotten into a habit of saying something like, well, if I can just get through this week, then, apparently everything would be fine, right? Like I would be less busy, or like I would have fewer kids or something. And then finally he just said to me, like, it is this week, right? Like, in other words, like, this is your life. You chose it. You're happy. Your kids are happy. You love your career. Like, this is it. Like this idea that there's some nirvana of peace. Like, so find your peace today. So anyway, I'm leaving on that spiritual note because it helps me. I find the mornings the hardest. So I go for long walks with the dogs. I sort of, try to think about, just stabilizing. And then the kids wake up and then, all hell breaks loose.
Yes, well, I'm feeling very smug and childless over here.
The now normal applies to everyone.
That's right. That's right. Well, thank you so much for joining us. We will be back next week with more questions from quarantine. You're welcome to tweet at us. You're welcome to follow Juliette, Kayyem, Margaret Bourdeaux individually on Twitter, and also the Belfer Center. And we will see you next week. Thank you.